Michigan. We're so glad you could join us this evening for this educational panel discussion on the state budget. What would a shutdown mean? We're delighted to have three expert panelists joining us this evening. They are Arnold Weinfeld, the Associate Director of the Institute for Public Policy and Social Research at Michigan State University. Arnold spent 20 years in the Michigan House of Representatives as a staff aide, policy analyst, and policy staff director. And Rachel Richards, the Director of Fiscal Policy and Government Relations at the Michigan League for Public Policy. Rachel is a tax policy and budget expert with over 15 years of experience from both inside and outside of state government, working on issues that support economic opportunity, promote social justice, and advance equity. And Robert Schneider, a senior research associate with the Citizens Research Council of Michigan, who previously worked within leadership of the nonpartisan House Fiscal Agency and the State Budget Office. Each of our panels will spend about 10 minutes sharing information on an area of particular interest on the state budget, and then we'll have time for questions and answers afterwards. In the next few days, we'll email everyone who registered the YouTube recording of the presentation along with PowerPoints. As a reminder, the League of Women Voters of Michigan is a nonpartisan political organization. The League works to increase understanding of major public policy issues, such as the importance of reaching agreement on a budget to avoid a statewide government shutdown. So with that, I am pleased to turn the program over to Bob to begin our discussion. Bob?
Hi, good evening, everybody. Thanks for attending. I want to thank the League for Women Voters for the invitation to be here today. Happy to participate in this forum on this important topic. I am going to share my screen, and you should see my title page.
Yes.
The state of Michigan budget is a shutdown coming. Everybody can see that. Sandra, I think I heard a thumbs up from you.
Yes.
So I'm going to work from this a handful of PowerPoint slides and walk through where we're at right now with the budget, and talk about the challenges that are still to be faced as we try to wrap up the budget, and that's going to have to do with both roads and the federal One Big Beautiful Bill Act, and some new challenges that has brought to the state. So this first slide just highlights where we're at right now. If there's good news, it's that both legislative chambers have now put full budget proposals on the table. The House has now passed its full budget. The Senate had done that back in May, and this chart highlights our two major state revenue funds. And these are the funds that make up probably 95% of the decisions in the budget. GFGP is general fund, general purpose. That's our primary tax revenue. Legislators and appropriators can do whatever they want with that revenue. And SAF is the school aid fund, and that is our major fund dedicated to education, mostly K-12 schools, but also higher education, community colleges and universities. And you'll see big differences in the appropriations from both funds between the House and the governor and the Senate. Governor and the Senate look quite a bit alike. House cut the general fund quite a lot, and added actually appropriations from the school aid fund. So big differences between the House and then the governor and the Senate, who are much closer. I want to run through three big challenges that are already presenting a challenge to resolving the budget, and are going to continue to. And we're going to start with road funding, and that's challenge one, and it's the biggest one, and it's probably the most significant one. The House, the Michigan House, led by the Republicans, passed a road plan in April, and it's one that would generate over $3 billion in new money for the roads. But their plan relied entirely on diverting existing revenue, and that means something that's appropriated right now for something else has to be moved to roads. A corporate income tax revenue would shift over $2 billion from our general fund that funds a whole bunch of other stuff to roads, and also converting the sales tax on gas and shifting that equivalent amount of revenue to roads, another $1 billion. Uh, After the House made its initial proposal, the governor also put a proposal on the table. Her proposal also proposes, let's take that sales tax, at 6% sales tax on gas. Let's take that revenue and shift it to the roads. So the governor's plan
Um,
also calls for $1 billion in cutting. Oh, am I not coming through?
can I ask you, oh, can you take that?
Oh, oh, sorry. I heard a voice. And So that also will take $1 billion from something else that's budgeted right now. But she plans in her proposal to raise other taxes, business taxes, the marijuana tax, to fill the gap. Both raise $3 billion in new revenue for roads. The House redirects it all from something else in the budget. The governor leans more heavily on new revenue from increased taxes. Resolving that will be critical to the budget because it's going to determine how much needs to be cut. Why did the House cut so much? Because they were trying to fund their roads proposal. The governor and the governor and the Senate did not make those kind of cuts. So roads and deciding how much are we gonna actually shift over to roads, and how much new revenue do we need for roads is the number one issue and challenge facing the budget reconciliation right now. The others come from the One Big Beautiful Bill Act, what I'll use the acronym OBA, One Big Beautiful Bill Act. First, the federal tax cuts for businesses from the OBA will spill into Michigan state revenue. Most of those big tax relief provisions have to do with expensing business expenses like research and development, new qualified production property that you can take off of your corporate income so you don't get taxed on at the federal level. Well, we use the same base in Michigan. So when OBA passes new tax relief provisions, those flow into our state taxes, and the House Fiscal Agency, one of the nonpartisan budget agencies in the legislature, put out a report this summer and suggested in fiscal year 26, that first blue bar you see there, we'll lose $677 million in state revenue due to those OBA provisions. That's not quite a third of our corporate income tax. It's a big amount of our corporate income tax revenue, and it's a large reduction in revenue to our general fund as well. So we already were trying to shift as much as $3 billion from the general fund to roads. Now here's another 600 million plus that we'll lose from our general fund. All of that revenue fades out over time very slowly, which will help revenues longer and longer term, but that's still a new problem now that adds on to the roads challenge. And then finally, Michigan has a special Medicaid provider tax that we call the insurance provider assessment. We generate over $600 million in revenue from this tax on health insurers. Some of that money goes back to compensate our Medicaid health plans who pay the tax. But most of it is revenue that we use to help save general fund and Medicaid. And what has happened is under the OBA and under a related federal rule, the federal government has said enough of that. We're not going to allow states to assess this type of unique tax, provider tax that the insurance provider assessment is. I'm not going to go into the wonky details of it, but it basically really heavily it shifts state costs to the federal government for Medicaid. They've said that no more of that, and this could, depending on how this federal rule is finalized, we could lose it immediately. And in fact, we're assuming that it will go away before or in the early part of fiscal year 26. So 3 challenges. We're going to lose up to $3 billion, and depending on what kind of decision is made on roads, we're going to lose the $670 million in state revenue tied to the OBA federal tax changes, and then almost $500 million in lost revenue that helps us save general fund today will also be gone. All of those things mean the budget needs to be cut very, very seriously, depending on the decisions on each of those challenges. I'd add one more thing, and you're going to hear more about OBA with Rachel speaking next. But the OBA isn't a one-time thing. There will be other state costs that will be added. We're going to need to do more cost sharing for federal food assistance, what's called the SNAP program, or the old food stamps program. We'll have more costs related to Medicaid from further cramping down on state Medicaid provider taxes. So even though we said that, for instance, the revenue impact of OBA goes away over time, other things take its place. So really, the full effect of OBA is probably $1 billion plus in lost state revenue, either lost revenue or increased costs, that's going to be kind of permanent. You see that as one thing goes away, something takes its place, and it's a fairly permanent budget hit to the state budget. And I'm going to close just to give you a look. We're going to need to take probably quite significant costs, whether it's the governor's road plan, the House's road plan. This general fund, general purpose budget will need to be cut significantly. I know Arnold's going to talk more about this, but when you need to make really big cuts in the general fund, 3/4 of that go to only 3 things: the universities, the corrections, our prison system, and health and human services, Medicaid, child welfare, safety net programs, and all the staffing that administer those programs. It's hard to make those cuts without those things being a big part of the reductions. So I'll close my 10 minutes here with what could happen next. October 1st is the beginning of the new fiscal year. Either the legislature and the governor and the Senate the House and Senate are going to come together and get to a deal before October 1. There is a possibility that we could put in some type of short-term budget, maybe for 30 days or something, to kind of fund like current state appropriations for another 30 days while we work on it. That's not been done before, but it's been pondered before, at least during some of the other years where we've had budget challenges. Or without a budget in place, most state operations are going to shut down. There'll be some critical areas like the prisons and certain DHHS programs, child protective services, state troopers at some minimal level. Things that are critical for public safety might be maintained, but you'll see most of the rest of state government operations shut down. And that's where we'll be at. So I hope that was helpful. I think we're going to go on to the next presenter and then take questions afterwards, if I'm right, Sandra, correct?
Yeah, that's great. Thank you so much, Bob. I really
Okay.
appreciate it. If you want to stop sharing,
Yep.
then I think Rachel's going to share her screen next, and we'll get started. Rachel Richards.
Yeah, good afternoon, everyone. Thank you so much for having me. I echo Bob's comments about this really important topic, and I'm really grateful to be part of this. So I'm going to kind of piggyback off of where Bob left off and talk about some of the impacts that we're going to see, not just on the state budget, but like what it means really for Michiganders and people at home. So I'm going to focus largely on kind of 2 core areas, and that's the Medicaid and the SNAP cuts that were included in the One Big Beautiful Bill, or the harmful federal mega bill. I'll be referring to it as the mega bill throughout. So I want to say, regardless of whether we're talking Medicaid or SNAP, the likelihood that you either have benefited from this program or know somebody who has benefited from the program or who currently receives services through Medicaid or SNAP is highly likely. Medicaid in Michigan covers 1 in 4 residents. Nationally, it's 1 in 5, but here in Michigan, it's 1 in 4. And that's about 2.6 million Michiganders. Of that, it's about 1 million children, and it's a significant portion, 16% of seniors and 37% of children in rural Michigan. It's also the largest payer of behavioral health services. It covers nearly half of births in Michigan, and it provides long-term services and supports for seniors and people with disabilities. So as Bob mentioned, we had what's known, the harmful federal mega bill came down in July and was signed. And I would say that, it wasn't just one big thing that they did with Medicaid. It was kind of this death to the Medicaid program by 1,000 cuts. And I've highlighted a couple of those changes here. Bob talked a bit about the state use of provider taxes, but two of the other really kind of core things are some increased and very, very strict work reporting requirements and more frequent eligibility checks, which are just going to create administrative barriers for persons who are covered through Medicaid and ultimately lead to coverage losses. And also the bill requires some beneficiary cost sharing, so it's going to just directly increase costs for people who are covered through Medicaid. And outside of finding state dollars or increasing revenue for these programs at the state level and kind of backfilling some of these changes, states in Michigan, as well as they have really 3 options. That's covering fewer people, reducing benefits, or cutting payments that we pay to hospitals and other healthcare providers. So really kind of what's potentially at risk. We could see up to 700,000 Michiganders that are at risk of losing coverage. We could also see the loss of coverage for optional services. These are services that we currently do provide for people who are covered through Medicaid, but we don't necessarily have to. So it's things like providing doula care or other, maternal health support. It's also community health workers. So, having people come in and help persons with disabilities to be able to stay in their home and stay healthy in their homes. It also could mean, some reductions in coverage for certain populations, but it's also going to have this very significant impact on our healthcare providers, including smaller reimbursements, with fewer folks covered through insurance. We'll see an increase in what's known as uncompensated care. So when you go and use the emergency room and you are unable to pay and you don't have health insurance, that is what's called uncompensated care. And all of these things could just result in like provider closures. People could choose not to take Medicaid. Hospitals could close. They could close, maternity wards, or specialty services could just move to other places where they could potentially have a bigger impact. So it just means it's going to mean increased costs for health insurance and healthcare, but also people are going to be having to look for healthcare elsewhere. And I would say that, a lot of people think that this is just a, urban issue, but it really isn't. There's over 20% of residents in 41 counties are covered by Medicaid, and 37 of those are rural. So it will also have this very disproportionate impact on rural communities. Another thing that a lot of folks don't really know about, they've heard about these Medicaid cuts, but there are about 500,000 Michiganders that have an Affordable Care Act marketplace healthcare plan, and they benefit from what's known as a provider or a premium tax credit. And so they are getting a tax credit that helps them to reduce their premium costs and to be able to afford healthcare through the Affordable Care Act exchange. We made some really good enhancements to these. And those enhancements over the last few years, they're going to expire at the end of this year. So what all this means is that there's going to be higher premiums for marketplace enrollees of all ages, so children, adults, families, and anybody who has to purchase their health insurance through the exchange rather than through like their employer or be connected to Medicaid. And then SNAP, the Supplemental Nutrition Assistance Program, again, it's 1.4 million Michiganders, over 500,000 children. And SNAP has very wide-ranging benefits. It's not just necessary to put food on tables, but it also, reduces healthcare costs and it strengthens healthcare for everybody. It improves mental health. It increases attendance at work and school. And it also helps boost income for farmers. And similarly to Medicaid, we are kind of seeing this death by 1,000 cuts associated with SNAP, including additional harsh work requirements, restrictions on future benefits, and then, as Bob noted, changes in the SNAP funding structure to require a state match for the first time in the program, the history of SNAP. So outside of finding new revenues, again, we're relying on reducing eligibility or potentially having to opt out of SNAP completely. So that's about $3 billion of food assistance that would no longer be going to Michigan households to keep food on their tables. And again, kind of similarly as we see in Medicaid, a significant portion of our rural and northern communities benefit from SNAP. This is just kind of one estimate that's kind of floating out there somewhere in the $390 million range. $410 million range is another one that I've seen recently. And it all kind of depends on where our benefits are and kind of what's known as our error rate. And error rates aren't just like fraudulently sending out SNAP benefits. It's things like errors that happen at the grocery store, or somebody's SNAP card gets skimmed. So it's a paperwork issue. So it's a number of things, and kind of where we are in terms of our error rate, kind of estimated somewhere in the $300 to $320 million range for a state cost share. And about another $90 to $100 million for admin costs. And so you're somewhere in the 390 to, like I said, 410 range that we're going to have to find within our state budget in order to in order to keep SNAP on the table. And then, so kind of taking a look at this, and I'm not proposing any of this, it's just for, purposes of kind of taking a look at this. What we could potentially do is, this $390 million represents about 60% of the general fund in our Michigan State Police budget. It also is about 2.5% of the overall general fund budget. But it's it's all of the general fund of a variety of state departments that we could, kind of claw back in order to make sure that we're finding those dollars for SNAP. And then kind of just to provide a little bit of context, we are, making these significant cuts to Medicaid and SNAP to provide huge tax breaks for wealthy Michiganders and profitable corporations. One of our national partners, the Institute on Taxation and Economic Policy, did a kind of a dollar for dollar analysis and determined that of the nearly $1 trillion in Medicaid cuts that this bill includes over the next 10 years, there's $1 trillion in tax cuts for the top 1% of Americans over that same period. So dollar for dollar, we're cutting Medicaid in order to provide tax cuts for the wealthiest Americans. And then, as I said before, kind of regardless of whether you're on Medicaid or SNAP, cuts to these programs are going to affect all of us. It's going to make things like groceries more expensive. It's going to make healthcare more expensive for everybody. It's also going to make things so much more difficult to access. And we already have so many communities that already don't have a hospital or are a grocery store desert or a food desert. And it's just going to make it so much harder for those families to be able to access those services. And have to travel much further. I mean, can you imagine being a pregnant woman in labor and having to drive 6 hours to find a maternity ward, or 5 hour, 3 hours to find a maternity ward in order to deliver a child. So this is going to impact all of us, regardless of whether you're on Medicaid or regardless of whether you have healthcare through your employer. And so just kind of watching to see the what those impacts are. So, and then we have a lot of more information on kind of what's coming down from the federal government up on our website. You'll all have access to these slides afterward as well. So feel free to check it out. So I'm going to stop sharing now so that we can go on to the next.
Okay, great. Thank you so much, Rachel Richards. That was wonderful. Arnold, you're next. Arnold Weinfeld, if you want to start speaking and share your screen.
Absolutely. Thank you, Sandra, and thank you to the League of Women Voters for this opportunity. Greatly appreciated. Greatly appreciate the work of folks such as Bob Schneider and Rachel Richards. And I'm going to pick up a bit on where Bob left off with his last slide and talk about the budget process, where we are now, some things that might be in jeopardy. So I saw in the question earlier if this is the normal process, and it is not. Far from it. For the last, I'm going to say 14 years, 8 years of Governor Schneider and 6 years of Governor Whitmer, the budget has typically been completed by early July. As a matter of fact, statutorily, that's when the budget is supposed to be completed by July 1st. But the Constitution mandates that the budget be completed by October 1st. So that's why the media frenzy and discussion right now with October 1st coming close. October 1st is when the state's fiscal year actually begins. So you may have been reading a bit about the negotiations over the summer, even beforehand and now. And as Bob mentioned, funding for the roads has been a big issue, especially for House Republicans and Governor Whitmer. And during the spring and early summer, it seemed as if to some that the governor was more aligned with Speaker Hall on his desire to combine a budget bill along with a roads package. And Senate Democrats, who control the state Senate, have been arguing to pass a budget first and then get to a transportation plan, that we need to have a budget first. Everyone agrees, let's get it clear. Everyone agrees that we need more money for roads. And when I say roads, I mean local roads. I mean, over the last 5 years or so, we've seen plenty of orange cones during the summer, spring, summer, and fall. But if you notice, most of those are on state or federal highways. Local roads are still suffering from a funding shortfall. And the deal that is being worked on would give more money to local communities, county road commissions to help repair those local roads, let alone state and federal roads. So there's no question we need more money for roads. The state Senate, as I said, under Democrats, has argued we need to have a budget first, and we cannot sacrifice programs that we have funded for so many years in human services and education in order to pay for roads. There's been a saying going around that we cannot take concrete over kids, in particular right now. Over the last few weeks, however, especially since Labor Day, tone has changed a bit. We've seen the governor standing with Senate Majority Leader Brinks, expressing unity on the state budget. And this week in particular, department heads have come out making it clear what the Republican passed budget would do to their agencies, from the Department of Health and Human Services to the Department of Environmental Quality. We've seen State Department heads come out and discuss what those changes would mean. Today, the governor gave a speech downtown where she also noted that it was time to get moving and pass a budget. So it seems as if now Senate Democrats and the governor are on the same page with getting a budget done by October 1st. In jeopardy, if we have a shutdown, and remind you, there's only been 2 shutdowns one in 2007 and one in 2009, and they only lasted a few hours into the wee hours of the morning of October 1st before a deal was struck. But one of the things that's probably going to happen really soon is many state employees are going to receive layoff notices. Why? Because union contracts call for a 2-week notice before a layoff. And we're there tomorrow. The 17th would be 2 weeks before October 1st. So we might see that yet tomorrow begin. And if there indeed was a shutdown, state parks and historic sites would certainly be shut down right away. Probably Secretary of State offices, you might still be able to access online services. Unemployment offices, road projects would probably come to a stop as well. And Bob noted that critical services such as state police and prisons would remain operating. Long term, payments to schools, K-12 schools, universities, and local governments would be impacted. And I say long term, but that's just a few days into the month. For instance, school districts expect payment on the 10th of the month, local governments, I believe, sometime in the middle to the end of the month, and so on and so forth. So we could probably, deal with a shutdown for a few days. That would have, most people probably would not feel it, admittedly, except those that need the payments, like in Medicaid, and other critical areas. But certainly, if it were to go on and on, it would definitely have an impact on operations, parents, children in the school districts, universities, local government services, so on and so forth. Now, where do we stand as of today? So I've talked about a bit about what the governor and the Senate Majority Leader have come to an agreement on. It appears the House Republicans are still pushing for a road plan. You may have been reading also various House Republicans stating that there are ghost employees or that there are millions of dollars in funding for programs that doesn't get spent, that's just sitting in departments. I'm not going to opine on whether any of that is true or not, although I did work, as Sandra noted, in state government for 20 years in the House of Reps. And I believe, if I had to make a statement, I believe that most of those comments could be proved false in one way or another. I'll say that. But the fact of the matter is, and I'm going to say this point blankly, the Beltway talk is that there's a shutdown coming. And now the conversation is for how long? I've talked to several people in the Beltway, so to speak, the Lansing Beltway, and there's now one person that doesn't believe we're going to have a shutdown. We're not going to have a shutdown. We're going to have a shutdown, everyone believes. Whether it's for a few hours or a few days is unclear. But the pools have already started. So if you know of one, get your bet down. It's unfortunate, indeed. I'm not sure to what political end it serves anyone, certainly to no policy end. But that's where we stand, folks. I have to say that's currently where we stand. So I'll stop there and hope I didn't send anyone down a rabbit hole of despondency.
Thank you so much, Arnold. So now we can open it up to questions. There are a couple of questions in the chat, and our co-president Denise Hartzow is going to start with some of the questions in the chat to our presenters, and then I have a few questions that I can throw out there as well. And feel free to put more questions in the chat. I'm sorry, not the chat, in the Q&A.
Yeah. All right. Well, I'm happy to be here with Lynn Komansky, the other co-president, also Judy Karanjeff, the former advocacy chair, who's here with Sandy, who's our current advocacy lead. So we're very happy to have so many great league leaders here today. So I did get a question that was texted to me This is wondering, are there any revenue increases that would have a chance of being passed by our state government? Revenue increases. Anybody like to answer that?
I'll take it on first, and then I'll let Bob and Rachel chime in. I doubt it. More like funding shifts, we'll see. One of the shifts that's been talked about, for instance, is no doubt you all have heard of the SOAR Economic Development Program that has been under extreme criticism by all quarters. There's $500 million still sitting in the SOAR fund. That could be used to help fund programs or roads itself. I doubt we'll see an increase in funding, more likely funding shifts.
Yeah, I would. I think the only way that you would get is if there was an agreement on if the governor and the House Republicans could come to an agreement on roads where the governor has proposed an increase in our marijuana excise tax. She's proposed some new business taxation that would be, but I don't. Can you? She proposed raising the marijuana tax in a percentage terms that would equate to what not like non-cigarette tobacco, chewing tobacco. 32% of the wholesale price. Could that happen? Maybe. And that would help towards the roads, and then it would mean less cutting to the general fund budget. But I would more agree with Arnold. I don't think you're going to have major revenue increases in any way, except something maybe that's tied to some compromise with the roads plan. I don't think you'd need House Republican votes for a tax increase, and I don't see those coming for a general tax increase to raise another $1 billion to fund state services. But something tied to the roads deal, I think, is at least possible.
Yeah, and Bob pretty much took my answer. So I was going to say kind of a very similar thing.
I'm glad I answered first.
But yeah, we need to get to 56 votes in the House, and the Republicans do have a majority there. So like we would, even if you counted on all 52 Dems voting in favor, House Dems in favor of a tax increase, you still have to get those at least 4 Republicans. So it would have to be some sort of compromise, something that, all kind of together and for a very specific purpose. That's just kind of where my thinking is going. I mean, so.
All right, thanks. Here are a couple questions about current spending. One wonders how much is our tourism budget, and then how much does Michigan spend per student compared to other states? And I'm guessing that means K-12 students. Does anybody have those kinds of figures at hand? That's kind of specific.
Because I mean, I would, in terms of the education funding, it's kind of hard to really do an apples to apples comparison, but I might have like a kind of an estimate of, and I just don't have it in front of me, but every state does kind of their education funding a little bit differently. So it's, it's really hard to make that apples to apples comparison. And determine where we are. But I will say, there are some states who, put more dollars into specific programs, whether it's literacy, whether it's funding for students who grow up in poverty and bring those adverse childhood in experiences with them to school, and just kind of our leaps and bounds above Michigan in terms of outcomes. Kind of nationally, Michigan continues to rank, in the bottom 10 states in terms of educational outcomes.
And I did not know this off the top of my head, but I saw the question, so I tried to look it up quickly on tourism. $16 million of our general fund, which is a lot of money when you and I think about it, but not a lot of money in terms of the $15 billion kind of general fund. And then I think we get another, it looks like we get another 10 from local and private sources to go on top of the 16 million that the state provides.
Thank you. Thanks for looking that up. Here's a question about impact. I'm guessing this question, it's about impact on libraries of the proposed budget. And I'm thinking maybe the proposed House budget, that might be the one that has the most consternation around it right now. Does anybody know anything specific about libraries?
I didn't know that again, but I tried to I tried to look it up quick. I don't know if I got an AI overview that's suggesting that it's flat, but I think Sandra, if I provided that answer, could you distribute it to people who a more authoritative answer other than Google AI? I'll look that up. I did not hear about any big cuts to libraries, but there were lots of cuts, so it certainly could have gotten lost in the shuffle. So I will send Sandra something on that she can share with folks who attended.
Great, thanks a lot.
Okay, so here's one that might fit in with some of the things that several of you addressed. What are the pros and cons of the road bill being included or done separately?
I think I'll speak for myself here. I think the order of how you do things needs to be figure out what you want the budget to look like. Am I willing to cut $1 billion from the general? You need general fund revenue is if you're going to shift money to the roads. Can I cut 500 million, $1 billion, $1.5 billion, $2 billion? There, you need to reach an agreement on, all right, what are we going to give up to fund the roads? And then come to what your roads plan looks like. I think until the legislature are the legislator are the lawmakers. They have the power of appropriation, so it is completely within their prerogative to shift revenue around. If roads are the priority, then by all means, shift more money to the roads and then take it from the lesser priority. But you need to make that budget decision on what's higher and lesser and how much more. I'll just, for instance, the House brought a higher education budget to the floor out of subcommittee that had very large operational cuts to all 15 state universities, and it couldn't pass. They had to actually adjust the higher education budget, put a lot of money back for all but the 3 research universities that took substantial cuts, and put a lot of the funding, operational funding, back. I think you need to determine what is it that we will live with in terms of cuts to the budget. Then you know how much is free to shift over to the roads, and then you can decide whether we do want to raise any revenue for roads from tax increases, marijuana, business taxes, whatever it is. I'm not sure if I answered the pros and cons question, but I think the order should be budget, roads, determine what we can cut, then do your roads plan.
Okay, this is maybe more of an informational question. What percentage of the sales tax is transferred to schools and local governments? And what percentage would be cut, or like, I guess maybe what amount would be cut if the proposed shift, if there was the proposed shift of the general fund or of the sales tax to roads? Is that what we're talking about? Yeah.
Yeah, it's, I can answer that. I think, so we have a 6% sales tax. And when you look at it in totality, I think it's roughly 75, maybe a little under 75% ends up going to K-12 schools. And about 10% is dedicated to cities, villages, and townships through constitutionally guaranteed revenue sharing. And then there's another revenue sharing pot that's kind of discretionary and it really doesn't rely so much on what comes from the sales tax. So, but if you add those up, that's 85%-ish of sales tax revenue goes through the constitutionally dedicated revenue sharing to the K-12 schools, which is the conundrum for both the governor and the House, who have, it's both the House and the governor we are going to hold schools harmless. We're going to hold local governments harmless. But then when you have the broader budget cuts, that makes it difficult.
There's a question here about the impact on nursing homes, and I assume that means the impact of all the different budgetary things going on. So maybe Rachel, you can talk about that, the Medicaid, the role of Medicaid in nursing homes.
Yeah, so as I said, that kind of the impacts that these Medicaid cuts are going to have on, Michiganders, but also on providers. So, nursing care facilities do provide a significant amount of care for persons who are covered through Medicaid. And if we're talking about reducing those reimbursement rates, that also would impact the reimbursement rates that those nursing care facilities are receiving. So if they're all of a sudden getting less for the care that they provide, it could impact their ability to take persons with Medicaid. And, kind of similarly, as we said with hospitals or other, healthcare providers generally, we could see, again, providers close completely. We could see them move to a different area of the state depending on population. They could see, a ward shut down or close, and kind of some shifting of services to other places. And I think it's the same impact that we're going to see on the healthcare system as a whole. We'll also see in the nursing care facilities, which, unfortunately, they're providing care for some of our most vulnerable residents, our seniors, persons with disabilities, and that care that they're going to receive will definitely be impacted by these cuts.
I'd add one thing. I'd agree with everything Rachel just said. Anytime Medicaid is under pressure with OBA, is going to pressure state funding for Medicaid. Big funding shifts from the general fund to roads is going to cause pressure on Medicaid because it's such a big part of the general fund. One, specifically the nursing homes, one area where they did get a break under OBA, unlike is with these provider taxes, where we assess nursing homes and hospitals and other providers' taxes, and we use it to leverage federal funds to pay Medicaid reimbursement. The nursing homes got a pass on the provider tax, so we will not have to reduce the current nursing home provider tax significantly, like we will the hospitals. The hospitals get hit hard on that. Nursing homes will be spared there. That does not mean the nursing homes won't be subject to cuts because we just have other financial pressures with Medicaid. But I would note one thing is that they did get a break from not being subject to the loss of some of their provider tax revenue.
Okay, thank you. There's a couple questions about the inclusion of something in the House plan about bringing state workers back to the office 5 days a week, eliminating all hybrid options. So just some curiosity around like why that's in there and how it makes sense with the stated effort to get rid of fraud, waste, and abuse. I don't know if that has anything to do with it. Anybody want to address that?
Yeah, I mean, House Republicans have adopted the philosophy that it's time to get people back in the offices. Given their broad attitude regarding ghost employees, they don't, they don't believe that people are actually working when they're working hybrid. And that attitude is not just, I'll say this, is that attitude is not just pervasive in the House Republican caucus, but that's a discussion going on all across the country, right? In businesses and the like. How to bring people back to work. Why is it important to bring people back to work so on and so forth. So, but that particular issue is yes, they think fraud's being committed and they want people back in the offices.
Then here is another process question, or a process question. Do the legislators have scheduled negotiating sessions, or is all this going on behind the scenes? Will we know if they're getting close, or will we just hear the parties calling each other out and figure out that the negotiations are going nowhere?
Yeah, I mean, I'm sure any of us could chime in on that one. So far as I know, there are no scheduled negotiations going on. Each side has said they've been talking, constantly talking, although Senator Brinks has said she hasn't spoken to Speaker Hall in some time. And usually, this process involves budget bills being passed by both the House and the Senate. And then we have what's called conference committees to work out the differences between the House and the Senate. We're not even there yet. So that's just another reason why I think people are really leaning toward there being a shutdown, because there still has to be some kind of process through this, even once they come to an agreement. So even if they came to agreement, in the wee hours of the morning on October 1st, there's still some impact that's going to occur until the budget is actually passed. And so, the process is just not what it has been in the past.
You, there are a couple questions about taxation, like the mode of taxation, progressive income tax versus a flat rate. Could somebody address why it is that we do what we do in Michigan?
Yeah, so I'll chime in here. Michigan constitutionally has a flat income tax rate. We are mandated to have a flat rate and a flat base. So all of your income is taxed at the same rate, regardless of where it's coming from, regardless of how much you make. Now, that's unlike the federal income tax that, after you make a little bit more, that little bit more is taxed at a little bit of a higher rate. So it's what's called a graduated income tax, a progressive income tax, and we've tried to get rid of that flat rate ban. I want to say 3 times since the 60s, I think, if I'm remembering right. And they've failed every single time. There's kind of then this renewed conversation. I saw a question that kind of ties with this. There is a ballot initiative that is currently collecting signatures to get on the ballot that would levy a surcharge. So not exactly create a full graduated income tax. Most folks would still be levied, still have that same 4.25% or whatever is in the current law rate, but very, very high income earners. So those making over, if you're single, $500,000 a year, or $1 million if you're married filing joint, that small little bit above it would also receive kind of a surcharge on top of that flat rate. So that's one that is currently circulating. They are collecting signatures. So that's a potential that we could see something like that on our ballot come November of next year.
We have time for one more question, Sandy?
Yes, I think one more question would be good.
Okay, this might be great for all the league members here. How would a shutdown affect the November general election? For example, voting registration online or no issuing of driver's licenses or state IDs?
Well, while there's Rachel can answer this. While there's a shutdown, those services aren't going to be available. The Secretary of State's offices will be closed. Even those employees that process the online, because even though when you do something online, there's still people behind there. They may be laid off for a time. So, people wanting driver's licenses or being able to vote come November, it's going to impact that. Rachel?
Yeah, I was going to say the one thing that I've been telling folks when I get into these rooms is if you have an October birthday, get your driver's license renewed, get your tags renewed. Go into the Secretary of State's office now and get that done. So come October, if we shut down again, those Secretary of State offices, the likelihood is that they won't operate. So, you know, kind of get everything done in advance as quickly as you can. So,
Take care of voter registration items now. Thank you all.
All right, thank you all. I have one burning question that I just want to ask, if you don't mind. Any idea when the federal government will shut down? And how would that interact with the state shutdown? No, maybe you don't want to
I-
answer that.
I think a federal government shutdown is less likely than a state government shutdown. And the
Okay.
federal government shutdown is, the federal government is used to, you know,
Yeah.
pushing things along with, you know, with temporary budgets. Is it possible? Yeah. But I'm more concerned about a state shutdown than a federal government shutdown,
All
personally.
right. Great. Well, thank you so much to our panelists here. Arnold Weinfeld, of the Associate Director of the Institute for Public Policy and Social Research at Michigan State University. Rachel Richards, Director of Fiscal Policy and Government Relations, Michigan League of for Public Policy. And Robert Schneider, Senior Research Associate at the Citizens Research Council of Michigan. And thank you to our Michigan League of Women Voters team, Co-President Lynn Kokmansky, Denise Hartzau, and former VP of Advocacy, Judy Karanjeff. And so we will put a YouTube recording of this on our website, and we'll also be able to post the presenters' PowerPoint presentations as they have some useful information. So thank you all for joining us, and thanks again to our presenters.
Thank you. Appreciate the opportunity.
Yeah, thank you very much.
Bye-bye.